It is impossible to rightly govern a nation without God and the Bible. George Washington. There is none justification for taking away individuals' freedom in the guise of public safety. Thomas Jefferson. That government is best which governs at least because its people discipline themselves. Thomas Jefferson.
Large group of eugenists involved in massive depopulation agenda. Now, you can actually look up any...
So I'm pleading to the three most prominent district commissioners to avoid another closure because, my business survived, but barely.
Not a single healthy child has died since COVID has been introduced into this world.
Your mandates and what you think is best for us, you cannot hinder the movement of a free people, and we are still a free people.
There is no
universe in Jesus Christ. I'm here to talk to the so-called county commissioners that were falsely elected into office. We will declare our independence. I have the Declaration of Independence.
Thank you. Next speaker, please. Next speaker, ma'am. Go ahead.
Wait for me. Back up.
Hi, my name is Teresa Hall, Hall. And I would just like to point out to begin, is that people begging you for money that isn't yours got 6 minutes, and we're limited down to 1.
You guys are representing us. We asking you, please, stop lying to everybody.
I'm sorry, can you repeat that, please? Sure. In terms of populations that have not gotten vaccinated, now we've heard that the elderly have gotten vaccinated at very high rates. Who is it that still needs to get vaccinated?
Yeah, certainly our biggest pockets of unvaccinated are younger folks, 12 and older, who are eligible for the vaccine. We're also seeing low rates among African American folks.
And what efforts is the health district taking in order to get those populations vaccinated?
Yeah, so we're doing some targeted efforts in several zip codes in the Southern Nevada, where we've seen both high rates of COVID activity as well as low vaccination rates. And when I say targeted efforts, I mean making vaccine accessible in those areas by actually setting up clinics in those zip codes, making vaccine available for folks in those areas. We're also doing some very aggressive marketing efforts, as well as some social media campaigning as well to try to encourage and promote vaccination, and doing so in such a way that we feel that the younger population especially would be more likely to take that messaging, if you will.
Is it the health districts themselves that is doing the outreach campaign to younger folks, or you have a contract with somebody else, or how does that work?
Yeah, so the health district is obviously very involved with this effort, but there's lots of community partners both at the local level and the state level that are working very aggressively to try to promote vaccinations as well as make vaccine available.
Okay, can you walk through sort of the social media platforms that the health district and its partners are using right now?
I can't speak to all the details, but one of the things that we're working on is we understand that young folks are very apt to use social media to get information and to do things. So we're working on some social media campaigns, including working with some social media influencers to try to get information out to that target population.
Okay, but again, I know you're not, maybe not all of it. Like for me, Facebook is cool because I'm in my 40s, but for my 16-year-old daughter or my 20-something folks who work for me, they don't use that because it's for dinosaurs. So, I guess I want to make sure. Say social media doesn't necessarily get at the population who we're trying to target. And are we using things like peer-to-peer networks, DMs, etc., in order to get at these folks?
Again, I don't understand the details of our campaign. I can certainly work with our public information office and get those details back to you tomorrow if you like.
Okay, that'd be great. And in terms of the sort of the targeted goals from your website, the population threshold, which I assume means herd immunity, right? that what the 70% population threshold for vaccination refers to?
Yeah, that was a threshold that initially the state had set for the so-called herd immunity. Of course, we were not able to get to that level. That is something that we do aspire to and something we're continuing to work to, but we recognize that we have a long way to go to get to that level.
Okay. Because on your website it says about 160,000 vaccinations that are still needed to reach that level. And if we're at 4,000 a day, we're still looking at about 40 days if we just maintain the 4,000 a day.
I'm sorry, can you repeat that, please?
So according to your website, it's about 160,000 vaccines that we still need in order to hit the 70% population threshold. Our current level of vaccination is around 4,000 per day. So according to my math, that's another 40 days before we hypothetically reach that 70% goal.
That's correct. Yes.
Okay. Thanks.
Commissioner Knapp.
Thank you, Madam Chair.
Excuse me, sir. Stop. Excuse me, sir. We're going to move you if you don't stop. Commissioner Knapp, go ahead.
Thank you, Madam Chair. Dr. Love, thank you for being here. I'd like a little bit about what we know about our currently hospitalized population. Wait just a moment.
Commissioner Knapp, could you please repeat the
Sure.
question because I'm not sure what it was.
So,
be sufficient at this point.
Well, certainly I think you could look at it if you want to do incremental steps, and perhaps just doing the mandate for employees might be a good solution. If you wanted to be much more aggressive, then a wider mask mandate might obviously be more effective in terms of being able to prevent the transmission of the virus. But either way, I think either one of those two measures, I think, will be effective in terms of being able to mitigate the transmission of this virus.
But we're here today because this is an emergency that quickly arose, right? And the Delta variant is posing significant public safety concerns and really required to impose some type of measures in order to try to mitigate it. Given how quickly this is rapidly developing, I hear you to say that we can impose potentially some mandate today, but that wouldn't prevent us from getting feedback and direction from you and the other members of the staff that would tell us that now is the point where we may need to take on additional restrictions.
That's correct.
Commissioner Sager-Blum, and then I want to chime in on the multi-agency group, so go ahead.
So I think you're going to answer this, but just to verify, I've heard this described as a pandemic of the unvaccinated.
A lot of folks, including the CDC director, have made reference to that. That's correct.
And what about having employers require employees to be vaccinated?
I think that presents a challenge, at least currently. I think the consensus is until the FDA full approval to the vaccine, then we can't make a mandate for vaccination at this time. Once the FDA fully approves these vaccines, then it's going to be a different story.
But as far as you know, employers have the right to insist their employees are vaccinated.
I believe so. I mean, there's been some efforts certainly within healthcare systems around the country to mandate vaccinations, and my limited knowledge of those situations indicate that those held up in a court of law. But and we do mandated vaccinations for children in school as well. So there is a possibility for that.
Excuse me, stop. Excuse me, stop. Dr. Loff, would you please finish your question? Commissioner Sager-Blum.
I was just asking about, mandating it as far as employers requiring it. That would be their option. But at the end of the day, what we need to do is we need to get this community vaccinated. That's the ultimate solution, right?
The ultimate solution, getting the community vaccinated, that's correct.
Thank you.
Okay, Commissioner McCurdy.
Thank you, Madam Chair, and thank you, Dr. Law, for coming to present. and sharing the information that you've been able to garner over the last year or so, with all of us equally sharing in the brunt of what happened in all of our lives during this pandemic. And what we've noticed is that, went from a point to where we didn't know anything about this virus. Then we got the information from all the healthcare experts. They provided their insight from their position. That was pushed down to the states so that we can be more aware. And now we're at a point to where we've experienced being locked down. We see our economy coming back. We see more business, opening up. We see more people starting to come visit Las Vegas. And what we're ultimately trying to do from where I sit is try to prevent us from ever going back to that place to where we were completely locked down, not being able to move, not being able to do business. And, unfortunately, this is just one of the things that we all have to agree to do to mitigate the spread of this new Delta variant so that we can gain more knowledge about what we're experiencing. So we've listened to a lot of testimony this afternoon about antibodies and how if you have antibodies and you've had COVID in the past, you may not need to get the vaccine. It will be helpful for you to state clearly from where you sit, based on your knowledge, why someone who have even had the virus in the past and may have antibodies today should still get that vaccine, and also go with the recommendations that the health district has set forward. Can you please clearly lay that out so that the people not only here in the audience, but also those who are watching, can understand from your expertise why we should still consider getting the vaccine?
Yeah, so certainly as people get a natural infection with the COVID virus, your body does develop an immune response to that. And that immune response may vary according to the person and their level of infection. And it may go away in a short time. It may persist for a long period of time. At this point, we don't really actually completely understand what the long-term immune response is to a natural infection with COVID. We just don't have enough experience with this particular virus to really answer that question. But we do have a lot of really good data about the effectiveness of the vaccine and the effectiveness of that immune response, the effectiveness of that vaccine's immune response being able to prevent infection with that COVID virus. So that's why we recommend that all people, regardless of whether or not they had a past infection with COVID or not, get the vaccine.
Thank you for that. So can you also lay out, where we are currently with the breakdown of age demographics, of the percentage of folks from those age demographics who are vaccinated? Can you lay that out, break it down, say people 65 and older, and give us a little bit of a understanding or breakdown of where we are right now?
Yeah, so the simplest way to provide the breakdown of vaccination by age group is to say this, that the older folks who first had access to this vaccine back in January and February have the highest vaccination rates in the country, and of course here in Southern Nevada. Whereas the younger folks who had the least amount of time to get vaccinated have had the lowest vaccination rates. And I think part of this data is also driven by the fact that older folks likely fear that they're more at risk for severe complications and death from this virus, which is why they want to get the vaccination, whereas the younger age group think oppositely. They feel that even though they may get exposed to the virus and get infected, that they're not going to come down with any complications. And that certainly may be true, but we also have to recognize that this is not just a disease of individuals, this is a disease of population. So vaccinations not only protect you from getting the virus, but it also, and more importantly in some cases, prevent you from transmitting the virus onto other people. So I think if we look at this from a community-based perspective, we have to understand that vaccinations are very effective in not only protecting yourselves, but more importantly, protecting your family and the community more broadly. The same can be said about the masks.
We pull samples, we run them, we determine that there is evidence of the illness of COVID in samples that have been drawn around the valley, and it's happening in all the cities all across the valley. What might you expect in terms of the passage of time before you actually begin to see positive cases, sick people? I mean, obviously, some of the people who were at home or elsewhere are already sick, but what kind of lead? You said a few minutes ago that we saw a spike and the results from the testing of the sewer,
Right.
followed by what period of time before we began to see the effect in the community?
Well, if you look at the natural history of infection, so you get infected, the virus reproduces in your body. That virus is excreted in your GI system. That in turn ends up in the sewage system. They do the sampling, and at that point in time, they're able to identify the relative concentrations of that virus at that point in time. But then you have to skip ahead several days before you start seeing people coming down with symptoms, and then start seeing people getting tested and start seeing increases in the test positivity rate. So the long and short of it is that this wastewater surveillance is a really good key metric or indicator, if you will, of what's happening in the community before we can actually identify cases because of delay between when people start to get sick to when they actually present to a hospital to get tested.
So on the 4th of July, the weekend of the 4th of July, we had a whole lot of people who were in close proximity with one another, celebrating, partying, doing whatever the people do, having fun on the 4th over the weekend. And when would you, as a public health expert, expect to begin to see effects from that? Is it 5 days? Is it a week? Is it somewhere between 3 and 10 days? Give us a sense of the way that you take the data and use it to predict what might be happening in the community.
Well, I would say within the wastewater data, I would suspect to see increases or spikes in that within 5 to 7 days, which is when people's levels of virus begin to increase. And at that point, people may start to get symptomatic, and once they get symptomatic, within a few days, they might go to their healthcare provider because they're not feeling well, and then at that point, they get a test. And then, of course, there's some delays in terms of when a person is tested to when that's reported to us, so that could be another 24 to 48 hours. So that's the general trajectory, if you will, of how these infections kind of play out.
So a week ago, Garth Brooks, Bruno Mars, a big fight all happened here in Las Vegas. Just kind of off the top, it sounds to me like maybe 100,000 people were in attendance indoors at a series of events, and the rooms were packed.
Right.
So we might expect, say, a week out from that. So this coming weekend,
right,
we may begin to see some effect from those activities. Is that essentially what you're saying?
That is correct.
Yeah. Now, when you start looking at the infections that we have, there's been some testimony offered today that the vaccines are not effective. They're not perfect. People still get COVID. And we've seen in this valley some what we call breakthrough infections. Is that correct?
That's correct. And
do you have a sense of the percentage of breakthrough infections that have been recorded?
Well, we do monitor for so-called breakthrough infections, which are infections that occur after someone is fully vaccinated. But we don't have a good sense of the overall scope of reinfections within the community because we're not able to really study identify every breakthrough infection, if you will.
So, in other words, some people may be asymptomatic, but they still may be infected.
Correct.
After a vaccine.
Again, the important point here is that no vaccine is 100% effective, but I think the important thing to know about this particular vaccine is that it's protecting people from getting severely ill, protecting people from having to go to the hospital, and it's protecting people from dying. So those are very good objectives and very good outcomes of using a vaccine.
We received a recommendation from you, and it went to the public in the form of a press release. In it, correct me if I'm wrong, the recommendation was masking indoors, not outdoors.
Correct.
Is that true?
That's correct.
And while the answer may be obvious, let me just ask why.
Well, indoors, of course, you have very enclosed spaces. Air circulation is not as good as it is outdoors, and we know that it's a virus that can travel through the air. So, if you're in a confined space with poor air circulation, especially in situations where you are around a number of other people, your risk of acquiring or transmitting the virus is so much greater than if you're outdoors where you have a open space. The virus is not as, and you have more opportunity also to be spread from one person to another. So it just doesn't transmit as well outdoors as it does in an indoor setting.
So you've recommended only indoor masking.
Correct.
Is that correct?
Yeah.
And let's say that we were to adopt some mask requirement. I think I heard you say earlier that if we were to do an employees only requirement for masking, it would pertain to those who were indoors or those employees who go indoors. So when they're indoors, they would be required to wear a mask.
Correct.
And when you look at the recommendation that you've made, what about people who work in an office by themselves or in a cubicle, even though there may be other employees? Are offices or cubicles areas where you would feel comfortable that folks could take their masks off and work?
Yeah, in fact, that's a new recommendation at the health district that we've implemented as of yesterday. So if any of our employees are in a public space within our building, meaning that they have an opportunity to be around other employees or members of the public, then we require that to wear a mask. If they're in their office or in their cubicle, then we do not require that mask to be worn.
You have not recommended anything at all about closures, have you?
We have not.
And we're not, in fact, I don't recall a time when the Southern Nevada Health District made some public, issued some public statement that we should close one thing or another. Am I right about that?
You're correct.
So there's never been a time in Southern Nevada where you recommended to us, and I can say we acted upon a recommendation to close anything. There's never been a time when we did that.
That's correct. All those mandates came down from the state.
Okay. So our objective here is to try and save lives, is to try and prevent infections, is to try and keep an economy moving that is at risk if our numbers get high enough that people get worried and they stop coming here.
That's right.
Do you have a sense of and I'm guessing we probably do not have, but do we have a sense of the comparison between folks who are infected that are visitors as opposed to folks who are residents of the community? And I ask that question because I know you can test the sewage in the resort corridor and where there are predominance of hotel rooms and likely more people who are from outside the community than inside the community. And is there anything in any of those test results that suggests something like that to us? Lots of infection, in where there are lots of hotels, not so much in another area. Anything like that? Have you seen any kind of a correlation like that?
I'm not as clear about those data, but my understanding from what I do know is that we're not seeing those kinds of correlations.
Okay. I think for now, Madam Chair, those are...
Okay. I'd like to speak a little bit. It was mentioned several times throughout this meeting. Just moments ago, we heard from our partners in business, both the Resort Association and the Chamber of Commerce, what some private employers have been doing to encourage vaccinations. I think there's a lot of partners in our community that have really stepped up, have done a wonderful, tremendous job helping educate their team members and helping to further our goal of increased vaccinations throughout our community in the effort to stay open and protect each other. Could we, Madam Chair, if it's appropriate, have a conversation about what the county has, Manager King, 10,000 employees. We all serve on other boards such as LVCVA, RTC, Metro, Fiscal Affairs, and we have 38 departments. What are we doing to encourage our employees? Is there further direction that this body should give to help further that goal?
So, Commissioner, we have early on we're offering vaccinations to all of our employees, and then most recently we had some on-site vaccination clinics to further encourage those who did not originally get their vaccinations on the first round of vaccines, that we also wanted to be able to offer that again in case we had employees that actually changed their minds. So every so often I encourage our employees to vaccinate. I believe as public servants it is our responsibility to, we're here to serve the public, and it's our responsibility to be the example to our community. So I do encourage employees to continue to be that example, because we are public servants and we're here to serve the public, and it's our responsibility, I believe, that we do provide that example for the community.
Thank you. I agree. I think we ought to be leading the way and certainly taking cue from some of in the private who've done a good job and striving to improve on that here within the county. Maybe I could request a manager information report to the board on ideas of how we can further that goal and maybe things that we've not yet tried, but looking to our partners in private business who've been successful at increasing their vaccination rate, putting together those ideas that would work within the county and our partner agencies.
Yes, we can absolutely do that for you.
Thank you.
Okay.
If I could just follow up on that, let's make sure the union is included in that.
The who?
Make sure the union's included.
Yep.
In the conversation?
Thank you, Commissioner Sagerblum. Yeah, our bargaining unit should be a part of that.
Okay, anyone else?
If we're asking for comments, I would go forward and say we need to start considering mandating our employees. If you aren't willing to get vaccinated, then you shouldn't be coming to work. And I saw something about the hospital. UMC Hospital had like a third of their employees were vaccinated. That's unacceptable.
Excuse me. Okay, so anybody else have any questions, anything for our senior management? So here's what I would, excuse me, we are in deliberation. So here's, I think at some point we'll need to make a motion one way or another. I think that, Ms. King, is that enough direction for just our employees, or what are you looking for?
That's enough direction. We will coordinate with the unions and gather their ideas as to how we can encourage our employees to vaccinate. Think of some additional ideas, and then we'll bring those back to you for your consideration.
Okay, the Clark County Commission will take a 10-minute recess.